Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. Introduction: Neuromuscular relaxants, also known as neuromuscular blocking agents, NMBAs, or muscle relaxants, are essential pharmacological tools used in various medical settings to induce muscle relaxation and facilitate surgical procedures or mechanical ventilation. These drugs act at the neuromuscular junction, interfering with the communication between motor neurons and muscle fibers. This essay explores the mechanisms, clinical applications, and potential risks associated with neuromuscular relaxants. Mechanisms of action. Neuromuscular relaxants primarily target the neuromuscular junction, the synapse where motor neurons communicate with muscle fibers. The neurotransmitter acetylcholine, ACH, is released from motor neurons, binding to receptors on muscle fibers and initiating muscle contraction. NMBAs interfere with this process through two main mechanisms. 1. Competitive inhibition. Non-depolarizing NMBAs competitively bind to the nicotinic acetylcholine receptors, NACRs, on muscle fibers. By occupying these receptors, the NMBAs prevent acetylcholine from binding and activating muscle contraction. This leads to muscle paralysis. 2. Depolarizing blockade. Depolarizing NMBAs, exemplified by succinylcholine, initially cause a brief depolarization of the muscle membrane, leading to fasciculations, muscle twitching. However, their persistent depolarization prevents the muscle from repolarizing, resulting in muscle paralysis. Clinical applications. Surgical procedures. Neuromuscular relaxants are crucial for surgical procedures that require muscle relaxation, such as abdominal, thoracic, and orthopedic surgeries. By inducing controlled paralysis, these drugs facilitate surgical access and improve surgical conditions. Mechanical ventilation. Patients requiring mechanical ventilation, particularly those with acute respiratory distress syndrome, ARDS, benefit from neuromuscular relaxants. These drugs prevent patient ventilator asynchrony, reduce oxygen consumption, and minimize the risk of lung injury due to excessive respiratory efforts. Electroconvulsive therapy, ECT. Neuromuscular relaxants are used during ECT, a treatment for severe psychiatric disorders. These drugs prevent the intense muscle contractions that would otherwise occur during the convulsive phase, ensuring patient safety. Endotracheal intubation. Rapid sequence intubation, a technique used to secure an airway quickly, often involves neuromuscular relaxants. They aid in facilitating intubation by relaxing the vocal cords and preventing laryngospasm. Risks and precautions. While neuromuscular relaxants have significant clinical benefits, their use comes with potential risks and precautions. 1. Respiratory depression. Overdosing or improper administration of NMBAs can lead to respiratory depression and even apnea. Adequate monitoring of the patient's ventilatory status is crucial. 2. Allergic reactions. Patients might experience allergic reactions to these drugs, necessitating careful patient history assessment and monitoring during administration. 3. Drug interactions. NMBAs can interact with other medications, including anesthetics and certain antibiotics, potentially exacerbating their effects or causing adverse reactions. 4. Delayed recovery. Prolonged muscle paralysis can lead to delayed recovery, particularly in patients with impaired kidney or liver function. 5. Malignant hyperthermia. Rarely, some patients may develop malignant hyperthermia, a potentially fatal reaction triggered by certain anesthetic agents or NMBAs. This condition requires immediate intervention. Conclusion: neuromuscular relaxants play a crucial role in modern medicine, enabling safer and more effective surgical procedures, mechanical ventilation, and other medical interventions. Understanding their mechanisms of action, clinical applications, and associated risks is essential for healthcare professionals to make informed decisions regarding their use. Careful dosing, patient monitoring, and adherence to best practices can help maximize the benefits of these drugs while minimizing potential complications.